exudate versus transudate. So we are going to look at exudate versus transudate. So when we look at exudate, like what we mentioned earlier, exudate is due to what? Increased capillary permeability. And then maybe because of inflammation. So because of those inflammation, that increased capillary permeability. And what type of fluid that is going to be moving? Very good. So it's going to be a fluid that is going to be rich in protein. So that's why with exudative effusion, we're going to have high protein. You're going to have a lot of cells, so many inflammatory cells. And those cells, because of the high turnover of those cells, right, they're going to be releasing, and the breakdown of those cells, they're going to be releasing a lot of what? LDH. So the LDH, which is lactate dehydrogenase, is going to be high in the fluid. And when you look at the specific gravity, because it's a lot of protein, a lot of cells, the specific gravity is going to be high. And when you look at the appearance of the fluid, they are usually cloudy and very thick. What about in transudate? So transudate is hydrostatic or uncoated pressure. Remember, we said that imbalance, changes in the Frank-Starling pressures. So that will lead to transudative effusion. So when you look at this fluid, they are usually very low in protein, they are low in LDH, they have fewer or non-cell or no cells at all. And they usually have a very low specific gravity, and they are very clear, watery fluid. So let's look at the causes of exudate. So which include infection. So if somebody have a pneumonia, so that could lead to parapneumonic effusion or empyema. Empyema is when you see pure pus, and your pH is going to be low. Your glucose is also going to be very low. Also, malignancy could also do exudate because that could cause capillary permeability. Pulmonary embolism, tuberculosis, pancreatitis, and rheumatologic disease like things like rheumatoid arthritis, SLE, all those could lead to exudative effusion because they could increase capillary permeability. And as opposed to transudate, here common causes include things like heart failure, which is the most common cause, right, because of the increasing hydrostatic pressure. Also cirrhosis, which could lead to hepatic hydrothorax, right, which is usually on the right side. Very good. And this is going to be due to decreased uncoated pressure, thereby leading to transudation of fluid into the either interstitial space or transcellular space. Also nephrotic syndrome because of loss of protein in the urine, or somebody who have hypoalbuminemia. A 45-year-old woman presents with fever, pruritic chest pain, and productive cough. So that sounds like this patient is having possible having what? Pneumonia. And a chest imaging shows unilateral and pleural effusion. So we say unilateral pleural effusion. Thoracosynthesis review cloudy fluid with numerous neutrophil. Remember, as we mentioned in the past, neutrophil is a what? Is the major cells that we see in acute inflammation. So when you see neutrophil, it's usually suggestive of acute inflammation. So based on this, so cloudy fluid with a lot of cells in it. So this is suggestive of what? Of exudative effusion. And with exudative effusion, we know that this is due to what? Increased capillary permeability. So the best answer there would be what? Would be C.